You've been hearing about it from Governor Greg Abbott, a fentanyl crisis in the state. Just recently, a big batch was caught crossing from Mexico into Presidio. But there's new developments in the fight against the drug, a vaccine for fentanyl developed by the University of Houston. We told you a little bit about it tonight, but Tyler Dupnick is here to tell us more about how this would impact us here in West Texas. Tyler.
Yeah, Crystal, it's a great question. There are certainly West Texans who would benefit from what the vaccine aims to do. The vaccine develops antibodies that will stop fentanyl from getting to the brain, which could subsequently save lives.
It's a very neat idea, I believe.
A vaccine for fentanyl is getting closer to clinical trials in humans, and the potential game-changing medicine could help two groups in particular in the Permian Basin. Drug addiction is common in West Texas, and that is one group that could benefit, with opiate addicts being among the most common type of drug addict to relapse. If they are vaccinated against fentanyl, it could save their life if they take an opiate that may be unknowingly laced with fentanyl. The Springboard Center in Midland is an addiction treatment center for drugs and alcohol, and they have seen fentanyl become more of a problem in the area.
It's only a matter of time typically before that kind of drug makes it to West Texas, Permian Basin. But no, it's rampant. It's out there, and like I said, probably a lot more available than people think.
Not only is fentanyl here, but the fight against it may get even tougher.
I think that it's definitely a problem in West Texas, and it's not getting better. I see it as increasing, and it's just a matter of time before it gets worse.
Law enforcement personnel are aware of the dangers of fentanyl as they are tasked with seizing it. The vaccine could help protect them too in the event that they may be exposed to fentanyl during the seizure of it.
It'd be a fantastic tool to help our people, our law enforcement community, our first responders, medics, paramedics, whatever, to help keep them from getting possibly overdosed by an accidental exposure. I think it's a great step forward.
Sheriff Mike Griffiths told me that he does not believe any of his officers have been exposed to fentanyl at this point in time, but they are proceeding with caution, and he advises everyone to do the same. With the threat of fentanyl still very much present in our community and state, the exact timeline for when the vaccine may be available is unknown at this time. Crystal.